Coming to pathogens and risk factors for CLABSI. What is CLABSI? It's a bloodstream infection in a patient who had a central venous catheter in place within 48 hours. So meaning either the patient is having a central venous catheter right now, or you have removed and the patient is getting an infection within 48 hours of removal. Okay, that's the idea. And within 48 hours before the onset of symptoms and no other identifiable source. It's different for surveillance by various societies like CDC and NHSN, but may not be always confirmed catheter as the source. That's very important. So it requires clinical judgment to distinguish from contamination or secondary bloodstream infection. So what are the risk factors? Catheter-related risk factors, the type of catheters. So central lines have a highest risk, especially the non-tunnel central venous catheters have the highest risk. Tunneled CVCs have slightly lower risk, and PICC lines, that peripherally inserted central lines, are not that much high risk. Peripheral lines don't have risk at all. To be honest, the risk is very, very negligible with peripheral lines. Site of insertion also carries a risk, and subclavian technically carries the lowest risk of infection, followed by internal jugular, and femoral carries the highest risk. And many studies are contradicting that, saying that femoral and IJV carries almost the same risk of infection if you maintain it properly. And duration of use, risk increases significantly beyond 7 to 14 days. Coming to urgency of insertion, emergency insertion definitely will increase risk because we may not be following the precautions adequately. And insertion technique also carries a risk, especially lack of full barrier precautions may increase the risk. And skin condition at insertion site is also going to play a role, like inflammation or colonization in that area might increase the risk of infection. What is the pathogenesis of CLABSI? So extraluminal is the most common. So, but it can be intraluminal also. What is extraluminal? The organism is going to come from the skin flora, track along into the catheter and into the bloodstream. Especially it's common in early infections. Intraluminal infections are common after 2 weeks of insertion of the catheter. So it is basically due to hub contamination, the hub that we're using to inject drugs. And that is going to enter into the catheter and it's going to colonize the catheter lumen, and it's going to take a bit of time. An endogenous seeding is very rare. From a distant infection, you're going to have infection of the catheter. And infused contamination may occur. It's extremely rare again. So contaminated IV fluids or additives during preparation might be the reason. All right. So what about the common pathogens in CLABSI? So it could be gram-positive organisms, gram-negative organisms, and fungal organisms. Gram-positive organisms are typically due to coagulase-negative Staphylococcus aureus or Enterococcus. Gram-negative organisms can be Pseudomonas, Klebsiella, Enterobacter, Acinetobacter, and fungal infections, especially it's going to be Candida. And we have discussed this so many times. It's going to be common in TPN patients, ICU patients, patients who have recently received transplants, or patients who are having history of multiple antibiotic use.